Good afternoon, everyone. I'm Dr. Nandyala Vishwanath, consultant neonatologist and pediatrician, KIMS Cuddles, Kondapur. Welcome to Cuddles online education. So today we'll be discussing a very important topic in NICU, which is neonatal transport. So transporting a neonate is a very challenging task to the parents, the neonates, and the healthcare provider, because there is a significant transition of care for the neonate, which involves a lot of safety concerns and risks in terms of vibration, noise, and other safety hazards, safety concerns which are involved. So the best and the safest way to transport is in utero transport, and now there are a lot of evidences which suggest that transporting in utero has improved outcomes in both mothers and neonates. Particular to neonates, neonates can be transferred for various indications like prematurity, low birth weight. When it comes to term babies like meconium aspiration, pulmonary hypertension, hypoxic ischemic encephalopathy, other surgical conditions like tracheoesophageal fistulas, diaphragmatic hernias, and more importantly, the congenital heart diseases like TGA, TA, PVC. So these are all the conditions for which a neonate can be transported. Sometimes there may be a transport for some therapeutic interventions like providing therapeutic hypothermia. Transporting a neonate can be within a hospital or between two hospitals. Within a hospital, the transport may be from OT or labor room to the NICU, or from NICU to the OT for other indications, performing some radiological investigations like MRI and ultrasound. A neonate can be transported. While transporting from one hospital to another hospital, there has to be a system which should be in place. There should be a proper coordination, involvement of healthcare professionals, and provided with neonatal equipments and transport system like ambulance should be in place to provide a proper safety environment for the transport. The key components involved in neonatal transport is, the first is the human resource, which involves doctors who get the proper pre-transport condition of the neonate, then the nurses, the other staff members, driver, ambulance. These are all the human resources. Next is the transport equipment, which is very crucial, followed by proper documentation of all the transport events and the communication to the parents. So today we'll be discussing in detail about the neonatal equipments which are involved, the transport bag, what all it contains, and the transport equipment in the ambulance. So let's go and see. So one of the key component of neonatal transport is neonatal transport bag. So a transport bag should be portable because it should be convenient for the healthcare professionals to carry all the items from the ambulance to the hospital or from hospital to the ambulance. So it should be preferably of these dimension and with 4 wheels for easy to facilitate the carrying. So next we'll be discussing the items which all is needed for a neonatal transport inside the bag. So preferably to have a checklist before a transport is initiated. The items pertaining to maintaining of neonatal airway is the transport bag should contain laryngoscope with appropriate size blades for both term and preterm neonates. Then ET tubes of all sizes starting from 2.5, 3, 3.5, 4, 4.5. Then bag and mask with reservoir and mask size for both term and preterm neonates, and elastic bandage to secure the endotracheal tube. Then coming, also there may be a conditions during transport, there may be untowards event where baby might develop some pneumothorax, or at the referring hospital there may be pneumothorax. So in order to drain the pneumo, the transport bag should have this trocar and also connection of ICD. Next is for the vascular access, the items are UVC, UAC and peripheral cannulas of all sizes. Next item which should be in the transport bag is medications. So the drugs which should be there, like inotropes, adrenaline, noradrenaline, hydrocortisone, dobutamine, dopamine, medications to give sedations like morphine, fentanyl. It's always good to carry prostaglandin infusion in case there is drug dependency in the baby. Also to carry anti-epileptics like levetiracetam or phenytoin or fosphenytoin. Comes the fluid part. Fluid, it should contain, the transport bag should have a normal saline and dextrose containing fluid D5, D10, D25, and then ringer lactate, and then OG tubes, suction catheters of all size, syringes of all sizes. Then better to carry an extra linens to wrap the baby, gloves of all the sizes. So one of the key component of neonatal transport is the transport ambulance. It should provide all the support which a neonate needs and minimize the risk of any safety hazards during the transport. So if you see the overview of an transport ambulance, it looks like this. So they have seating arrangement for the doctors and the nurses, and it can accompany one or two relatives who will accompany the neonate during the transport. So let's come and see in detail about the other equipments inside the transport ambulance. So the inside of the incubator looks like this, where we keep the neonate, and then the ventilator tubings are here with the temperature probe. We connect the ventilator tubes to the endotracheal tube, and then down there is some soft gel mattress which helps in dampening of the vibrations which may be felt during the transport. Now coming to the ventilator, this Globetrotter has an integrated ventilator system where if you see continued mandatory ventilation, and then there are few knobs to adjust the settings. Here you can see the ventilator flow where you can adjust the flow to maximum of 10, and these are the knobs. Here if you can see, adjustment of PEEP can be done, inspiratory time based on the neonatal disease specific condition, you can adjust the inspiratory time. Then the peak inspiratory pressure can be set here. And then here you can see the blender where you can adjust the FiO2, which can be from 21 to 100%. So it has also an inbuilt suction apparatus which is connected here on the back side, which can be used for suctioning. And then we have all the electrical system through which the power is supplied. Then we have a multi-para monitor through which we can observe the neonate's vital parameters like heart rate, saturation, blood pressure, and then a stand which includes all the infusion pumps. We can connect as many as 8 to 10 infusion pumps simultaneously at a time, which is backed by the power source. And then there are additional space for providing the air oxygen cylinders, and there is inbuilt space in the ambulance where additional 2 cylinders of oxygen can be carried. So overall, the neonatal transport ambulance need to have all these necessary support to provide whatever is needed by the baby. So in our unit, we are using the neonatal transport system, which is Globetrotter by the Dragger. Here you can see the transport system is mobile. It can be used for transporting the baby from the NICU to the ambulance. And here there is a slot for oxygen cylinders. Here you can see the incubator system, and the plus point of this Globetrotter is it comes with an integrated ventilator system. So, and there is a slot provided on the top where we usually use it for fixing the inhaled nitric oxide equipment on the top of this, or else you can put the multi-para monitor to keep checking the vitals of the neonate. So coming to the incubator per se, here the front panel shows the display where you can see the power mode, the battery life, and the heater output. The mode has there are two modes. One you can see the baby temperature monitor where you can see the exact temperature of the baby will be displayed here, and then the air temperature, which you can increase once it turns green. Then you can increase or decrease the air temperature. So here we have other parameters which shows high temperature, power failure, sensor, heater temperature. The other alarms can be seen here on the display. So it comes with a battery backup which usually lasts around 3 hours. If no electrical power supply is there, even then it will run for 3 hours. So the incubator itself is transparent, see-through, where you can see the neonates and assess the color of the baby, and there are ports available through which we can easily access and assess the neonates hemodynamics, like checking the pulse, checking the temperature. Neonatal transport is not a easy task. It's a challenging task, and it involves a formidable risk to the neonates, to the parents, and the healthcare providers. But with a proper system in place, proper equipments, and proper coordination, it can be done in a successful way with least possible risks.